Jails are really ground zero for the opioid epidemic in the nation. And what better place is there to have meaningful interventions to support people who are facing opioid use disorder.
Massachusetts is among the first, maybe the first, to be delivering medications for opioid use disorder inside of jails. And so that is an amazing example of how they're here in Massachusetts. The justice system is on like the forefront of what is, I think, of as a public health innovation. So it's this opportunity to learn from this sort of experiment to see how can we know whether this is effective, how do we implement it, what does it cost to implement a program like this, so that we can then provide feedback back to not just Massachusetts, but our country and justice systems elsewhere on how to implement a similar system like this.
In Massachusetts, the jails that are currently being evaluated from an exploration, preparation, implementation, and sustainability perspective, these MOUD, medication for opioid use disorder programs, are happening in a diversity of locations, right? In urban houses of corrections, suburban and rural houses of corrections. And so we're able to use our mixed methods approaches to understand the context that surrounds implementation.
And part of Mass JCOIN's goal is to ensure that we are all able to do the most rigorous evaluation possible to make the case to our legislators in the Commonwealth that this program should be continued and expanded to the other jails in the state, but also to be able to make the case to legislators in other states by having the most rigorous evidence available.
And it's a heavy lift to bring this kind of intervention into a carceral setting. So we need to make sure that it works well. And our team of researchers is devoted to seeing that what outcomes are positive and what's working and what's not. So this sort of like program evaluation is necessary with such a large investment of money and energy into the program. And we want to improve it. We want to improve the outcomes for the incarcerated patients that we're working with, because public health strategies are, I believe it's the future for public safety.